This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness Podcast. I'm Dr. Judson Brandeis, and I'm so glad you're here. Today, we're tackling an issue that's often ignored, yet affects millions of men: overactive bladder, or OAB. If you've ever felt the need to urinate so suddenly and urgently that it disrupted your day or your night, you're not alone. OAB is one of the most common urologic conditions among men, yet it's shrouded in misunderstanding, stigma, and silence. Too many men believe this is just an inevitable part of aging or simply something they have to live with. It's not. OAB can be managed, treated, and even reversed in some cases with the right knowledge and care. So what exactly is overactive bladder? It's defined as urinary urgency, usually accompanied by increased frequency and nocturia, waking up during the night to urinate, with or without urgency incontinence. Importantly, this diagnosis applies only when there is no underlying infection or other structural explanation for the symptoms. Think of the bladder like a balloon with a mind of its own, signaling you to go before it's full, sometimes without warning, and other times without the ability to hold back. OAB is not caused by weak willpower or poor hygiene. It's a disorder of bladder signaling, and it deserves medical attention. How does OAB work? Imagine the nerves and muscles involved in bladder control acting like an orchestra. Normally, they play in harmony, signaling when to hold and when to release. In OAB, that harmony is disrupted. The bladder muscle, or detrusor, contracts too early or too often, even when the bladder isn't full. This leads to feelings of urgency, and in some cases, leakage. Sometimes OAB symptoms are worsened by other factors, like fluid intake, medications, constipation, obesity, or untreated sleep apnea. That's why a full evaluation matters. Is OAB new? Not at all, but our understanding and treatment options have evolved tremendously. The 2024 AUA SUFU guideline offers a comprehensive roadmap for evaluating and treating idiopathic, non-neurogenic OAB. For initial diagnosis, clinicians begin with a detailed medical history, physical exam, and urinalysis. From there, tools like bladder diaries and validated symptom questionnaires help define the severity and pattern of symptoms. Imaging or advanced testing like urodynamics is reserved for complex or unclear cases. So why don't more men know about this? OAB isn't glamorous. Unlike erectile dysfunction or prostate cancer, it doesn't get much attention in the media or public health conversations. Many men are embarrassed to bring it up with their doctors. Others assume it's just part of getting older. Even worse, OAB symptoms often get lumped under the umbrella of benign prostatic hyperplasia, BPH, leading to inappropriate treatment or misdiagnoses. We also face challenges like limited insurance coverage for certain therapies, a lack of trained specialists in some areas, and cultural taboos around discussing urinary issues. What do patients actually experience? The day-to-day burden is immense. Men may go to the bathroom 10, 15, even 20 times a day. They may avoid travel, reduce fluid intake to dangerous levels, or suffer nighttime awakenings that impair sleep and energy. Urgency. Urinary incontinence can lead to embarrassment, social withdrawal, and depression. The emotional toll is real. But the treatment path doesn't have to be invasive or extreme. Initial management often begins with behavioral therapies, like bladder training, timed voiding, and fluid management. Non-invasive strategies also include pelvic floor muscle exercises and dietary changes. When lifestyle changes aren't enough, medications like antimuscarinics and beta-3 agonists can offer significant relief. While effective, they aren't for everyone. Antimuscarinics, for example, can cause dry mouth, constipation, and, most concerning, have been linked to cognitive impairment in older adults. That's why shared decision-making is critical. We must weigh the benefits against the risks and prioritize patient preferences. For men who don't respond to oral therapies or who can't tolerate the side effects, we now have excellent minimally invasive options. These include intradetrusor Botox injections, which relax the bladder muscle, percutaneous tibial nerve stimulation, PTNS, which modulates nerve activity through a small needle near the ankle, and sacral neuromodulation, which uses an implanted device to recalibrate bladder signals, similar to a pacemaker. These treatments are safe, well-studied, and can be life-changing. Personalized urologic care is the key. At my practice, no two OAB treatment plans are identical. We consider the full person: bladder symptoms, lifestyle, goals, other medical issues, and how the condition is affecting their physical and emotional health. That's where we stand apart. We bring together diagnostics, cutting-edge therapies, and lifestyle counseling to create a strategy that fits the individual, not the statistics. How effective is OAB treatment? Quite simply, it works. Behavioral therapies reduce symptoms significantly for many men. Medications offer relief in up to 70% of patients. And neuromodulation and Botox can achieve symptom control in the majority of those who pursue them. But success isn't just about symptom scores. It's about restoring dignity, confidence, and the ability to live without fear of urgency or accidents. Looking ahead, the future of urology, and OAB care in particular, is incredibly promising. We're seeing the emergence of regenerative therapies, wearable diagnostics, and artificial intelligence tools that can analyze symptom patterns and optimize treatment choices. Telehealth has made access easier, especially for follow-up care. And ongoing research continues to explore the gut-bladder connection, hormonal influences, and immune-related factors that may one day offer new paths for prevention and cure. I do this work because I believe men deserve better answers and better care. Too many suffer in silence, convinced that bladder issues are something to hide or just live with. They're not. OAB is real, it's treatable, and no man should face it alone. Thank you for listening to the Global Men's Wellness Podcast. I'm Dr. Judson Brandeis. Let's move forward with clarity, courage, and compassion. Your health deserves nothing less. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.